Hello? Hello?
Hey girl, hey.
Hey. My doctor told me to come here to pick up my ARBs.
Well, you've come to the right place, but before I can give you this medication, I just want to make sure that you have a clear understanding of what this medication is used for. Here at ARBs, we're dedicated to ensuring that our clients are consuming our products correctly and safely.
Well, my doctor said I needed to learn about the medicine I was taking so I can monitor my blood pressure better. So I guess I'll just sock it up.
Great! I'm glad to see that you've taken an interest in learning about angiotensin II receptor blockers, also known as ARBs. Are you aware of which ARB you're prescribed?
Yeah, here it is.
And go.
Here it is.
Okay, it looks like you're prescribed valsartan for your hypertension. Notice how the drug's name ends in artin. Drugs in the angiotensin II receptor blocker category end in artin.
Oh, I can remember that. Because ARBs and artin both start with AR.
That's a great way to remember that. Some other drugs that fall into this category include losartan, candesartan, irbesartan, azosartan, epirsartan, olmesartan, and telmisartan. Not only can they be used to treat high blood pressure, they can also be used to treat diabetic nephropathy, congestive heart failure, myocardial infarctions, diabetic retinopathy, and prevention of strokes.
Well, I don't have any of those other problems, just hypertension. So how do ARBs help with that?
Well, it might be a little difficult for me to explain verbally, so let's head on over to the whiteboard so it'll make things easier to understand.
Okay, if I have to.
So first, let me explain how the body increases blood pressure as a normal physiological response.
How can an increase in blood pressure be good?
Because in certain situations, the body may need to maintain a fluid balance as a part of homeostasis. So let's take a look at how this works. So in order to increase blood pressure in the body first needs to notice a decrease in extracellular volume and or a decrease in arterial blood pressure. The juxtaglomerular cells of the kidney recognize these changes and secrete an enzyme called renin. Meanwhile, the liver has produced a peptide hormone called angiotensinogen. This hormone is chemically altered in the presence of renin, and the result is angiotensin I. This new hormone, in the presence of angiotensin converting enzyme, or ACE, results in the production of angiotensin II. Angiotensin II stimulates the adrenal cortex to release aldosterone, a mineralocorticoid hormone that causes sodium reabsorption to increase by acting on the distal tubules and collecting ducts of the nephron in the kidneys. Since water follows sodium in the body, this results in an increase in vascular volume and thus an increase in blood pressure. Angiotensin II also acts on peripheral arterioles, which increases systemic vascular resistance and thus increasing blood pressure in this manner as well.
So how do my medications come into play?
Okay, so when you take this medication orally, it is rapidly absorbed. ARBs have a very wide range of bioavailability and absorption is not affected by food, except for valsartan where there is an approximate 50% reduction and epirsartan where bioavailability is increased. After the medication enters the bloodstream, it acts on the angiotensin II receptors on the adrenal cortex and peripheral arterioles and blocks angiotensin II from performing its action.
So that's going to stop my blood pressure from rising?
Exactly. The drug is metabolized in the liver and excreted mainly in the feces, 83% to be exact, and in the urine, 13%.
Is there anything I should know before I start taking my medicine?
Well, You can take it with or without food, and preferably in the morning to get in a routine of taking the medication. These medications are generally well tolerated, but don't take this medication if you are pregnant. Discontinue it if you notice any allergic reactions, and do not use it if you have moderate to severe aortic stenosis.
So, should I stop taking my medicine if I break out in hives?
Exactly. Now, you may not notice a decrease in your blood pressure because this medication may take many weeks to take full effect. Also, do not expect to feel different due to having a normal blood pressure. Hypertension can go unnoticed until end organ damage occurs. Many people quit taking these medications because no effect is felt from them, but it is very important to keep your blood pressure in normal range in order to maintain your health.
Well, how do I know if my medicine is working then?
You should have a follow-up appointment with your doctor to assess the medication's effect in your body. They will make sure your blood pressure is in normal range and check for negative side effects that are possible when taking these medications. You need to tell them if you're experiencing fatigue, headaches, back pain, dizziness, cough, nausea and vomiting, or abdominal pain. Because this medication is excreted by the liver and kidneys, they should assess for increases in creatinine, blood urea nitrogen or BUN, liver enzymes, and bilirubin. There is a possibility an electrolyte imbalance, especially if combined with another antihypertensive such as a diuretic that is not potassium sparing. Therefore, they might assess your potassium levels as well.
Oh my goodness, that was so much information. I'm hungry now. Can I get my number 3 now?
Bye, Felicia.